Generic drugs often save you a lot of money over name brand pharmaceuticals. But as On Your Side consumer advocate Jen Strathman uncovered, prices of some generics have skyrocketed by hundreds or even thousands of percentage points over the past few years.
Well, people with full health insurance may not notice any difference in their copays, but those who have to pay for drugs out of pocket are seeing big changes. Patrick Gunn is getting a headache trying to treat it. His migraine medication costs are skyrocketing.
Each time I went back, it seemed to go higher. So the first time, the out-of-pocket was like $9. The second time I went back, it was $12. Then finally, it went for a couple months where I was good, didn't need anything. I went back and it had gone up to $40.
Similar problem for John Popow. His costs were fluctuating wildly.
$100 a tube to $5 a tube.
In the last year, several generic medications spiked in price. Nystatin is a popular skin rash medication. It tripled. This anti-inflammatory increased 5,000%. It was $650, now it's $293. One reason for the skyrocketing prices, fewer generic drug manufacturers.
There's one or two manufacturers remaining, and then their price would thus go up exponentially.
Insured patients may not have noticed the difference, but that doesn't mean you won't pick up the cost.
Eventually, the price of the insurance might go up to either the company or the individual.
If you need to buy a pricey generic out of pocket and can't afford it, talk with your pharmacist. Many will call your doctor and switch you to a cheaper alternative, or switch pharmacies. The North Coast Health Ministry in Lakewood helped John find a new one.
Dr. Thompson looked up and was able to actually look and see what was the cheaper place for me to go, as a patient.
Another option is to contact the pharmaceutical company directly. They may offer a 30-day free trial or a small discount on the price for a limited time. An increasing number of people without prescription drug coverage are also taking potentially dangerous measures to save money on their health care. Consumer Reports found 2/3 put off a doctor's visit or declined a medical test because of cost, while others reported cutting bills in half to save money, which lowers the effectiveness of your treatment.
All right, Jen, so how can we all save money at the pharmacy?
Talk with your pharmacist, because there's a lot of discount programs out there that the pharmacies run, and also they have these discount drugs that you can get. So we have all the details for the local programs on newsnet5.com.
Ask a lot of questions.
Absolutely.
Thanks, Jen.